Hi, my name is Jaime Elizabeth Blackmon, and the title of this poster is Clinical Psychology Consultations in Support of Corrections Employees Engaged in Intervention Design Efforts. This case study reports on the strengths and challenges of integrating a clinical perspective and participatory action research in order to address mental health issues in corrections as a part of Total Worker Health Initiative. Just to give a little background, corrections is a unique employment setting with numerous sources of stress, such as high risk for physical harm, familial tensions, psychological stress, and occupational burnout. To increase effectiveness of intervention planning efforts, high-tech researchers recruited an experienced graduate student in clinical psychology to share her clinical expertise directly with employees during their intervention planning efforts. This poster does discuss the multifaceted 4I approach, which is introduction, integration, implementation, and interpretation. And the findings were that members of the union-led employee design teams engaged in intervention planning efforts, they benefited from receiving expert support in 6 key areas. These 6 key areas are also noted on the poster, but I will point out that these areas parallel some of the key areas we would see in clinical psychology. So for example, validating employees' mental health concerns is consistent with the therapist wanting to validate their client's concerns. Point number 5 talks about receiving advice on how to disseminate information to peers in non-threatening ways. In the clinical psychology world, this would parallel how to communicate effectively. To summarize this, the 4I approach was used successfully to orient and train a graduate student in clinical psychology to share her expertise to support employee participatory design of total worker health interventions, and this benefited the mental health of corrections workers. Integrating clinical expertise in design team efforts, it's feasible and advantageous for developing interventions that will improve the quality of corrections employees' mental health. So future participatory action research may benefit from including the 4I approach, and this could be further refined and streamlined to involve other interdisciplinary perspectives.